Are you in a phase of cancer treatment where you feel like you're spending more time in the hospital or doctor's office than out? Here in the recovery room, we frequently talk about exercise because for cancer survivors, research strongly suggests it can directly impact the quality of your life, the length of your life, and your overall survival. So yet again, here we are talking exercise, but in this episode I am talking directly to people with either stage 4 disease or to people who for some reason have become completely debilitated by cancer treatment. I'm cancer physical therapy specialist, Dr. Leslie Waltke. Welcome to the recovery room for key tips on how to exercise when you don't feel strong enough to exercise. Key point number 1, unless someone is literally in the last hours or days of their life, exercise will be of value. Even if you are bedbound, you should be doing at least 2 short exercise sessions per day. Now remember, the word moderate of moderate exercise is defined by how you feel right now. So moderate can change from day to day, and that's okay. So if you are sick, weak, and in bed most of the day, sitting or standing at the side of the bed for 2 to 5 minutes may constitute as moderate exercise. The sicker you get, the more important it is to exercise. Key point number 2, no matter how low your blood counts go, exercise is safe. But that being said, if your white count is dangerously low, you need to be protected from infection. But you can still exercise. You can still find a safe way to exercise. If your platelets that help clot your blood are low, again, it is safe to exercise, but you will need to find safe things to do, like walking and avoiding things like heavy lifting. Once your counts rebound, you can revert back to your regular activities and exercise. If you don't know what is safe or what to do, leads me to key point number 3. If you are so weak or limited you can't exercise, or you just are not exercising, have your doctor get you to a physical therapist. Even if you are stuck in the hospital for a couple of days, have your doctor call in a PT, because with rare exception, you should be up and moving as much as possible. So now I'm going to show you some cool, easy, low-level exercises you can do if you are grossly fatigued by either cancer or cancer treatment. And my exercise demonstrator today is Sue. Sue is living with metastatic breast cancer in her lungs and peritoneum. Sue has been on both ends of the exercise spectrum scale, from completing a triathlon to struggling to stand and do a flight of stairs. Hey, I want to introduce you to my friend Sue.
Hi.
Sue, all right, and has been through and come back from a couple of really serious butt kickings.
Yes.
And so I thought she would be a great example of somebody to talk to how to exercise when you feel really, really crappy, either from the disease itself, which she has been through, and when you feel really, really crappy from treatment, which she has been through.
Yes.
And now here she is walking laps with me.
Many kinds of fatigue, and they all are pretty horrible when you're talking cancer-related fatigue and medicine. Chemo fatigue, I've never felt fatigue that intense.
Yeah. So, Sue, what did you do on your really, really worst days when you just couldn't do anything? Did you do something, or how did you get through that?
So there are times where I just had to force myself to get out, go walk on a treadmill, get on my bike on the trainer, and just to get moving, just even a little bit. And it's amazing how much energy that gave me then.
Yeah, so you would do a couple minutes and actually would feel better.
Yeah, definitely.
Okay.
Like instead of taking a nap,
Yeah.
I would get up and go do something, and then I'd have energy for the rest of my, what I needed to do for the day.
Spectacular.
It makes a huge difference.
All right, so we're gonna finish our lap, and then Sue and I are gonna demonstrate some really easy exercises to do when you are at the bottom of your energy level. Stay tuned. I want to begin by showing you 2 super easy arm exercises. The first is what I call the sitting arm lift. You can lift your arms to the side 5 to 10 times, either from a standing position or a sitting position. Lift as high as you can, as comfortably as you can, and then come on back down. Repeat anywhere from 5 to 15 times. The second is the wall push-up. Find any area in your home or hospital room that's not going to move when you lean on it, and simply do push-ups against the wall. The further you move your feet back, the harder it is. So if it's too hard, move your feet forward a little bit. Again, I would start with 5 to 10 repetitions and build as you get stronger up to 30 repetitions. Now let's look at some exercises for your legs. If you are super fatigued and very weak in the legs, a nice place to start is with a standing chair squat. Find some piece of furniture to hold on to and then gently just drop your knees an inch or two and then come back to standing position. If you'd like to progress to something a bit more challenging, begin with a wall squat. Put your buttocks on the wall. And again, just slowly lower your legs and lower your body down just until you feel a good amount of muscle contraction in your thighs, and then come on back up. You get to control how far down you lower yourself. Again, 5 to 30 repetitions is good. The most challenging piece for a sit to stand is literally getting yourself in a chair and using the arms to lift and lower your body from sitting to standing repeatedly, again, about 5 to 15 times. As you get stronger, you can progress to doing the sit to stand without using your arms. Thanks, Sue. If you are living with stage 4 disease or really struggling with cancer treatment and really feel really weak, call your doctor or nurse to get a physical therapy consult. Hang in there, care well for yourself, feel the love around you, and exercise like your life depends on it, because it does. I'm Dr. Leslie Waltke. Let's talk again soon.
Hi.